I reached out to you following your excellent video that you gave at Stanford. And earlier in this discussion, you said, let's talk about what we know, which I think is a very grounded and appreciated approach to the situation, to this crisis. Over the past few weeks, there has been an influx of editorials and commentaries and interviews about the epidemic. And many notable people from different fields have chimed in with their opinions and ideas. There has been modeling by biophysicists and bioinformaticians and many conversations with virologists and other experts. And it's a bit of a mess for a layperson to understand what can they trust at the moment. So in your opinion, could you recommend some guidelines when someone is reading one of these articles in the New York Times or the Washington Post, how to assess whether the commentator is the right person to listen to?
Yeah, I think that's a really hard thing. I think that Twitter has actually lately been trying to start and go and give check marks to real epidemiologists and infectious disease experts who have large following bases to try to help people identify who they can trust. I think that still doesn't, of course, there's a lot of experts who don't have large following bases and who are still very trustworthy. The thing here is, I think, while we do need a lot of cross-discipline interaction, so it is important to listen to the engineers who know a lot about virus transmission and how it survives on different surfaces and how it spreads. I think a lot of attention at this moment needs to go to real well-respected epidemiologists and public health officials who really understand the complexity of the problem. So I think what's hard here is that a lot of people are good at math and think, okay, there's some numbers here and I can plug this in, but the modeling that's involved in these kinds of predictions is actually quite complicated, and it's a whole field. So I think people who think that they, can do some quick epidemiology are taking the microphone away from the people we really need to be listening to right now. But that said, I do also think that a lot of scientists are doing their best and trying to reach out in their own communities and trying to break down some very complex information in a way that's very helpful. I think that's wonderful. And I think all of us should be doing that. And I think all of us should be kind of offering help in our own family circles and community circles and neighborhoods and kind of our own realm of influence to really try to break down what of this is credible and what's not. It's very tricky because everybody is hearing scientists discuss these things in real time on bioarchives, on Twitter, on all these different platforms, on LinkedIn. So, people are going on and talking about real-time information, even as we haven't yet had time to review these papers and really think about them and understand these studies and do them carefully enough. So that's very hard. One thing that I wish that all of the communication was coming out of the CDC or, places that I wish every country was really just designating that their own agencies that are dedicated to this were the ones providing the information. I think it's really important that we don't politicize all of this, and that we really have a way of listening to the people that we need to be trusting. So, I think this is a moment to really be listening to what the CDC is saying. If you're in the U.S. and in other countries, to really be listening to the people who know how to communicate with the public about this kind of infectious disease outbreak.